Welcome to the Conversation Lab. I'm Don Schaefer. If democracy begins in conversation, then we need to nurture a culture where ordinary people like us routinely talk about those things that help us understand each other, whether it's about climate, race, religion, gender, or politics. When we're trying to make sense of our city and the world we live in, every question comes with a set of assumptions about the nature of ourselves and our place in a larger world. The Conversation Lab provides a safe place to talk about some of those things. This program is produced by CFRO-FM in Vancouver. It's available on air and online on various platforms, and we appreciate the help of Vancouver's community groups. Welcome to another edition of the Conversation Lab. My name is Don Schaefer, and today we're speaking with Marion Crow. Marion is a proud member of the Piapot First Nation in Saskatchewan, and she was the founding executive director and now the chief executive officer of the First Nations Health Managers Association.
Hi, Don. It's Marion. How are you?
Hi, Marion. I'm terrific. It's so nice to hear your voice.
It's good to hear yours. I apologize for not being on video.
It's okay. It's, Zoom is so weird. I mean, it just seems that we've all moved online, so it's actually nice to have a conversation. And I can just imagine where you are and what you're doing.
Well, I am on the road. I'm in Tyndonega territory, so I'm just pulled into a quiet spot and going to enjoy our conversation.
Well, I really appreciate your joining us. It's interesting that I met you online on your Facebook broadcast on the radio. I was really struck by what you were doing, the content and the guest you had. And I never knew that there was a COVID app, so now I'm aware of it.
Oh, I'm happy to hear that.
So you've been a busy woman.
Well, a team of busy people.
I wanted to start the conversation by asking about what is the FNHMA? That's quite the acronym.
It is the First Nations Health Managers Association. So we're a national nonprofit organization exclusively serving the needs of communities in the area of certification and professional development. So what all that means is we have a professional designation for health directors, health managers who are looking for a designation and certification recognizing their experience and wisdom in First Nation health services delivery. So that's what I have the pleasure and humble privilege of doing in my CEO role.
Now, if I'm not mistaken, you were originally the founding executive director. And going back to the early days, I'm curious what your calling was. You saw a need, and I'm just curious what prompted you to pull the organization together.
I love that question, John. I have really humble beginnings. I was pushing a mail cart in Saskatchewan, in Regina. At the time, it was called Medical Services Branch, now known as First Nations and Inuit Health Branch. And I was a co-op student going to school and working as a student through university. And I decided to stay with the federal government. And I got recruited to Ottawa from Regina. I did a number of unique things in the government. And then I heard about this file called Health Managers. And it really piqued my interest as a First Nations woman. And I had a bit of experience in being a founding board of director for the Aboriginal Financial Officers Association. And this had health on it. So certifying health directors was the vision. And I had to get on that. I found my calling, and I have since left the federal government and began FNHMA. So thanks to partnering with the Assembly of First Nations and Health Canada, we were able to start an advisory group that, really picked up on the dialogue about how pivotal and how important a health director role is in our nation. So I'm home.
Good for you. And they're lucky to have you.
Well, I have the best staff and board, and the best part about it is seeing all of the amazing and wonderful things people are doing across Turtle Island under, trying situations, unique delivery services. And I'm just super privileged to be in this position.
Did you ever expect to confront COVID-19?
Never. I mean, I was in the federal government when H1N1 hit, and that was really big, but I never expected this. And here we are, this global pandemic facing our most vulnerable population.
And how do you think we're doing?
Well, I mean,
It's probably a loaded question.
it is, but for the most part, communities have a lot of lessons that they can call on, a lot of history when it comes to pandemics. And I'm really proud of the nations that have exercised sovereignty, closed their borders, the partnerships that have really percolated to the top to keep communities safe. I think, the numbers are climbing in First Nations. We're seeing the reports from Indigenous Services Canada that come out daily. As an organization, we track those as well. But that's like mainstream Canada. The numbers are climbing, especially out here in the East. But I think overall, communities are much better equipped and prepared since H1N1 days.
Do you think there's more that the rest of Canada can learn and observe and follow?
Oh, there are so many opportunities to look at the wise and promising practices that we can learn from First Nation communities during this crisis. I think our nations do a lot more with a lot less, which demonstrates innovation, ingenuity, a whole sense of community. One of the shining examples I think of in response to this that's unique to other areas of Canada is, there's a community who is weaving together Western and traditional medicines. So the community came together, organized themselves, and made baskets for every member of their community. In those baskets was the Western recognition of hand sanitizers, cleaners, all the things that we need to prepare and to fight COVID-19. And then also incorporated in those were medicines. There was cedar in them, sage. And I just think that is a visual of First Nation health in that one example that explains so much.
How long have you been doing the broadcast on Facebook, and what are you trying to accomplish?
Well, we started the town halls way back in March. At the end of March, we partnered, built on the partnership we already have with Indigenous Services Canada, and recognized that we had a unique reach to grassroots health directors and managers. So we thought we would respond with doing an information session. We kind of thought it would be a one-off at that time, not recognizing that there was a thirst to get credible, relevant, and timely information into the hands of those that needed it right away. And so that, time has come and gone, and we continued with 13 town halls that took us to the end of June. We took a pause over the summer, and now we're back with one more town hall under our belt. So we've had 14 now, and we're going to continue for another 11. That's the plan so far, Don.
It's got to be a lot of work.
You know what? It doesn't seem like work when you truly care and have found your calling and what your purpose is supposed to be, this comes easy. And when you have people that are counting on getting this information, you just got to reach deep and get it done. And I have to say, the partners that FNHMA has have really stepped up, have shared their information. And, there's so many agencies and organizations that have come together that we're unlikely pairings. So we're super excited to count on all of the people that lift up the health directors, but also this organization.
The couple of town halls that I've watched, as you mentioned, bring lots of different groups together. I have to give you and your team credit for doing that because you've really been the catalyst to bring about those conversations.
Thank you for the compliment. My team is amazing.
I was struck by Dr. Evan Adams' overview of BC and the country in one of the town halls. I was quite struck by the COVID app. I'm curious because when I was watching that, you were downloading it. How are you finding it?
I love the app. I'm encouraging everybody to use the app. I just took a look at it earlier and I'm still no detection, so I'm quite pleased. I hope others are inspired to download it as well, especially when we think about the population that we're serving, some of the most vulnerable, at need, at risk populations. And that's all because of the social determinants of health that play in a nation. If you're talking about, social distancing, how do you do that when you have tuberculosis in the nation, you have overcrowding and lack of infrastructure in terms of drinking water, mold in the house? So when you think about some of the conditions, to get out relevant messages that are easily understood, it just makes all of this work that much more meaningful. And we can't lose sight of being in a marathon, not a race. So the more people that use the app, I think the better we're doing at protecting just the whole population in general.
Any concerns about privacy?
There's always going to be concerns about privacy. We can't get away from that. I used to work in e-health solutions at one point and understand, the principles of ownership, control, access, possession of data. But when it becomes a global pandemic like what we're in right now, I think using technology to safeguard our health is vital at this time.
So, general question about your organization. It's a not-for-profit. Lots of not-for-profits in the country, especially now, are hanging on by their fingernails and having trouble finding funding and keeping the doors open to provide the services that they provide. How are you finding life in this new environment?
Oh, you know what, John, you're right. I keep a close network with other leaders who are managing nonprofits, and it is tough times for everybody, recognizing that the economy is being hit so hard right now, especially the Indigenous economy. I'm so happy that our organization and the board have been nimble and been very quick to respond, but also, the whole team at FNHMA, we looked at where we were losing own source revenue and quickly adapted our learning modules. So before COVID, we were meeting in person, training intensively with a cohort of, 15 to 30 people. And the team just launched an online platform yesterday, actually, Dawn. We were able to quickly respond with a new education platform. So thankful for the team for being able to do that, get technology being used. And we have 90 students right now in our program as of yesterday.
This radio program and podcast is called The Conversation Lab, and we're speaking with Marion